Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about peptic ulcers. In particular, I will cover what is a peptic ulcer, how do you treat peptic ulcers, and how you can live with peptic ulcers. So to start with, what is it? An ulcer is a hole or a sore in the lining of an organ. Peptic ulcer is the collective name that is given to ulcers that affect the digestive system, specifically the stomach and duodenum, which is the upper part of the small intestine. An ulcer in the stomach is called a gastric ulcer, and an ulcer in the duodenum is known as a duodenal ulcer. So the symptoms would be burning pain is the most common peptic ulcer symptom. The pain is caused by the ulcer and is aggravated by stomach acid coming in contact with ulcerated area. The pain typically may be felt anywhere from your navel up to your breastbone and last from a few minutes to several hours, and could be worse when your stomach is empty. It could flare at night and often be temporarily relieved by eating certain foods that buffer stomach acid or by taking an anti-acid reducing medicine. They could disappear and then return for a few days or weeks, and less often ulcers may cause severe signs or symptoms such as vomiting of blood, which may appear red or black, dark blood in stools or stools that are black and tarry, nausea or vomiting, unexplained weight loss, appetite changes. So peptic ulcers are usually caused in one or two ways. Although stress and spicy foods were once thought to be the main causes of peptic ulcers, doctors now know that the cause of most ulcers is the bacteria Helicobacter pylori. So causes 80% of gastric ulcers and 95% of duodenal ulcers. The second most common cause of peptic ulcers is painkillers called non-steroidal anti-inflammatory drugs, or NSAIDs, such as aspirin and Nurofen. NSAIDs cause the remaining 20% of gastric and 5% of duodenal ulcers. So H. pylori infections are very common, and it is often possible to be infected without realizing it because the infection does not usually cause any symptoms. However, in some cases, an H. pylori infection can cause the protective mucus lining your stomach to become inflamed and swollen. As the sensitive wall of your stomach is no longer protected by the stomach lining, stomach acid can damage it, causing an ulcer to develop. Non-steroidal anti-inflammatory drugs, such as Nurofen or aspirin, are medicines that are commonly used to treat aches, pains, and swellings such as inflammation, headache, and toothache. So some of the NSAIDs, such as Nurofen, are available over the counter, and others, such as Difene and Feldene, are only available on prescription. Most of the time, NSAIDs are safe to use and do not cause any side effects. However, if NSAIDs are taken over long periods of time, they can damage the protective mucus lining in your stomach, resulting in a peptic ulcer or bleeding. Due to the risk of getting stomach ulcers, you should not use NSAIDs if you currently have a peptic ulcer or if you have had one in the past. So next is, how do you treat peptic ulcers? The first step for treating peptic ulcers is to remove the cause of the ulcer, such as H. pylori infection or non-steroidal anti-inflammatory drugs. Treatment for peptic ulcers focuses on either reducing the amount of acid in your stomach so that the ulcer has time to heal, or treating the H. pylori infection. The type of treatment that you will receive for peptic ulcer will depend on what's causing it. Peptic ulcers that are H. pylori negative, so if you have a peptic ulcer and you are tested negative for the H. pylori infection, your GP will prescribe tablets called proton pump inhibitors. So PPIs include Losec, Zotone, and Nexium. Peptic ulcers that are H. pylori positive, so if you have a peptic ulcer and you have tested positive for Helicobacter infection, you will need to have treatment to clear the infection from your stomach. H. pylori infections are usually treated using triple therapy. So peptic ulcers caused by NSAIDs. If your peptic ulcer has occurred as a result of taking a non-steroidal anti-inflammatory drug, if possible, you will need to stop taking them. And other treatments for peptic ulcers would be antacids, Antacids are a type of medicine that can provide immediate short-term relief for symptoms of indigestion. They work by neutralizing the acid in your stomach, making it less acidic. And alginates, some antacids contain a medicine called an alginate, which also helps to relieve indigestion caused by acid reflux. Also, you can use an H2 receptor antagonist. H2 receptor antagonists work by reducing the amount of acid in your stomach. So they would be Zantac and Pepcid. And finally, how do you live with peptic ulcer? During this treatment, while taking any medicines your doctor will prescribe, you will want to learn how to reduce and prevent, if possible, the symptoms of peptic ulcers. So this involves a few lifestyle and diet modifications. So maybe eat 6 small meals instead of 3 big meals every day. Don't eat or drink anything for at least 2 hours before going to bed. Avoid foods that trigger excessive acid production or heartburn. So don't drink alcohol, don't smoke, relax as much as possible, and avoid certain over-the-counter pain relievers such as the NSAIDs like Nurofen. Finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing peptic ulcers more effectively on a day-to-day basis. To start with, we have numerous products to get you started on an exercise program should you wish. So we have floor mats and exercise balls. We tailor an exercise program specifically to you. We also have various supplements and products which you can buy without a prescription, such as probiotics, calcium, zinc, and peppermint oil, Buscopan, Colpramin. And also recently you can now purchase Nexium and Losec without prescription, and you can buy Pepcid and Zantac also. You can also get antacids such as Reni, alginates, psyllium husk, and vitamin A. We also stock light boxes to promote relaxation, blood pressure monitors, and blood sugar monitors, and body fat monitors. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering at Telehealth Clinic. You can book a 30-minute clinic with us, and we help to increase your understanding and knowledge of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing your illness with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.